Hi, I'm Dr. Martin Rutherford. I am a chiropractor here in Reno since 1980, and more recently, over the last several years, I have been certified as a functional medicine practitioner.
Dr. Randall Gates, I'm a board-certified chiropractic neurologist, as well as being a chiropractor.
And we're going to talk about weight loss. We're going to talk about weight loss today. It's that time of the year. It's 2 weeks to go till New Year's Eve. Everybody's getting ready for weight loss. And why would we be talking about weight loss? Frankly, we marry two disciplines here, the discipline of functional medicine and the discipline of functional neurology, which combines the discipline of working with the brain and the nervous system, as well as the chemistry of the gut and the endocrine system and the the immune system, so on and so forth, to treat chronic pain and chronic diseases. We do a lot of fibromyalgia, peripheral neuropathy, dizziness, vertigo, balance, restless legs. So how do we come about talking about weight loss? Well, we noticed that all of our patients that came in for years lost weight. And upon interviewing them, we became more surprised to find out that most of these patients were patients who could never lose weight. An example would be one of the patients who came in and said, I ride my bike 20 miles a day every day and I eat 1,600 calories for the last year and I've lost 6 pounds. Another one who just started, I go to the gym 5 days a week. I exercise for an hour and a half to 2.5 hours. I'm eating 800 pounds. I'm eating 800 calories. I can't lose the weight. So it became obvious that a lot of these, that a lot of the weight loss was bound up in the same mechanisms that were causing people the types of issues that we were treating in our chronic pain practice. So that's how we got into weight loss. And we have a pretty comprehensive and I think a pretty accurate paradigm for what a patient who cannot lose weight. They've gone through Jenny Craig and they've lost and came back, whatever they've done. And when that person comes in, I'm listening heavily for thyroid. I'm listening for blood sugar. I'm listening for stress, adrenals. Excuse me, perfect time. I got something in my throat. And gut problems. And then that kind of flowers out into a number of other things. Would you like to jump in on that?
Absolutely, I'd love to.
Dr. Gates does all the treatment here. Currently, I'm doing most of the intakes. I'm screening patients, including weight patients, to see if you would be a proper candidate for what we do, because our success rate is very high. But it's high because we do a very, very sophisticated screening process, as well as a pretty comprehensive exam and very targeted testing. The treatment is highly individualistic, and so it really takes kind of a team to work on this whole project to make sure that if you're coming in here and you're dishing out your hard-earned dollars, that you're going to get the results, that you're going to lose weight, and that you're going to get the tools to keep the weight off. So
exactly. So yeah, I mean, there's a lot of people that go on low-calorie diets this time of year. If you lose weight, fantastic. But again, a lot of our patients don't lose weight. And there's a growing segment, or at least there's a large segment of the population who that seems to apply to. And that's even really being discussed in the literature now, in the obesity literature. And we cited an article 2 weeks ago when we did a presentation called Weight Loss Part 1, Beyond the Calories, I think is what it was titled, where we discussed an article and they said it's almost a public health disservice to continue to talk about calories in terms of weight loss. You as an individual out there, whatever you do, you're a fireman, you're a teacher, you shouldn't be held responsible to know how to lose weight. And it's the scientific community's responsibility to disseminate the appropriate and accurate literature to you so you have the best advantage to do so. And calories in, calories out is a decade-old phenomenon that doesn't seem to apply to a lot of people today. That being said, why? The reason why is that weight loss has become more complex in 2014 than it seems as though it was in 1994. We now know there are many, many more things involved, as Dr. Rutherford alluded to. We were just at a functional medicine conference and an anti-aging conference put on mainly by medical doctors. I'd say probably 90% of the people there were medical doctors or DOs. And they have a tendency to focus on, or they used to have a tendency to focus on hormones and hormone treatments and things of that nature. But they've shifted to what we're doing because they admittedly said this stuff
This
seems
works.
to work. Well, it works because a lot of our focus is gut centric. So our focus is on the gastrointestinal tract. We should do one called Big Gut Can't Lose Weight or something like that. Because with weight loss, everything we eat goes into our gut. But what we're finding is that the standard American diet feeds certain types of bacteria in the gut. And those bacteria are responsible for you having an inability to lose weight. I know that may sound like we're out on a limb, but we're not.
Oh,
there are many articles coming out last year in the mainstream media discussing bacteria in the gut and weight loss. And they've done these fecal transplant experiments where they basically take feces out of someone who's thin, put them into someone who's obese, and then that person starts losing weight. And we now know, yeah. And so they start eating the standard American diet again when the bacteria shift back to the way they were before. And so pieces of bacteria can go into the bloodstream, causing a host of downstream consequences, namely you to make more insulin when you eat carbohydrates. So even if you're eating 1,000 calories a day, the little carbohydrates that you're eating, you're making more insulin. And when we make insulin, insulin grows tissue. So to kind of bring it down, basically, the gut is really, really an important feature to all of this in terms of losing weight. And also what I want to say is that, say you're eating 1,000 calories a day, but you're eating 1,000 calories in pasta or 1,000 calories in cereal. I used to do that to lose weight for sports. And you're still maybe eating the same foods that feed the bad bacteria that won't allow the bacterial species in your intestines to shift to where they need to be for you to lose weight. All of us know in the scientific community that one of the best diets is to eat a diet full of vegetables, many different colors. That across every study, they say that is what we need to do. And the reason why that works in large part is that it does shift the bacteria in the gut for a lot of people. Now, continuing on, hormones can be huge in this. Insulin is a hormone, so we have to look at insulin levels with our patients. We have to look at thyroid hormones with our patients.
Mismanaged thyroids, undiagnosed thyroids, diagnosed and mismanaged thyroids, autoimmune thyroids. That's a whole aspect to it in itself.
Yes, including thyroid conversion, which is a whole aspect in of itself. Because you may have normal thyroid hormones from one perspective where your thyroid makes enough hormone, but your body can't utilize it. Then there are sex hormones, because a lot of patients who gain weight, especially you men out there, when you gain weight, then your hormonal profile shifts. And the same thing happens for women too. But basically, you may start taking on the non-dominant hormone. So you see guys and they start to get the fleshy breast tissue.
So in other words, men start getting more estrogen than they should have. Women start getting more testosterone than they should have.
And those can be factors that prohibit adequate weight loss.
All of that has to be evaluated. Stress has to be evaluated.
Okay. So this is obviously a very big issue. And just so you know out there, we're doing a series right now called Weight Loss Beyond the Calories. We did part 1 2 weeks ago, or last week. We're going to do the next one next week. So tune in and watch these broadcasts, because we're going to present a lot of detailed information on this. But I think we've kind of presented the overview.
Yeah, I did an article one time in Healthy Beginnings about a year ago. I think it was about a year ago. Maybe it was 2 years ago. I don't know. It's called The 7 Reasons You'll Never Lose Weight. The bottom line is that if you know all the reasons, and we are very conversant with all the reasons, patient comes in, you do the interview, you start looking in that box. This is the I can't lose weight no matter what I do box. It's the thyroid, it's the blood sugar, it's the adrenal, it's detoxification. I mean, if you're toxic and your fat cells don't want to even, your body doesn't want to let your fat cells go, because that's where your toxins are all stored. And the body and the brain knows if you start letting it go, that it's going to poison your system. So there's a whole box that in which there are a number of different tools, if you will, that can be used to get you to lose the weight. It's not the same for everybody, so that's why these one-shot, one size fits all type of calorie type. The calories are out the door. If you're the person who can go out there and run 30 minutes a day, 5 days a week, and cut your calories down to 1,500 calories a day and lose weight, this isn't for you. This is for all you people who cannot lose weight no matter what you do. We've had people in here over 400 pounds and do well. Okay, so that's really the takeaway. The takeaway is it's a little complex, but the mechanisms are known. You throw all those mechanisms in the box, you do a good history, you do a good exam, and you figure out what those mechanisms are, you address them in an integrated fashion, and mostly without drugs, primarily without drugs. We work in an integrated work fashion with some osteopaths and medical doctors and so on for support on a small percentage of our cases. But if you want to lose weight, this is the way to do it. If you want to lose weight, you can do it. This is really what it takes. There's no easy way out, but there is a way out. So if you have any more questions, you can email us at powerhealthtalk.com. You can look us up on Facebook, and we'll try to answer your questions.
Thank you for watching.